Don't start.
Hello, can you hear me? Hello?
Yes, sir. Hear you.
Okay, you can hear me. Okay. So sorry for being late. It's been a busy day for me. I would have probably suspended the class, but because I never told you before, I don't want us to start on that note. So, we have 7 persons connecting already. So what I'm going to do today, to give room for us to make up to 10, please call your colleagues that are not here that we have started. The moment I have 10, then we're going to start. So, but in the meantime, is there any question arising from what we studied last, what we discussed last? I believe you can still hear me, right? Hello, can you still hear me?
Yes, sir. We can still hear you.
Okay, great. So, is there any question coming from the last discussion? Any question? Please, at any point you cannot hear me, you do well to chat me up. Just comment on the chat box. Then we can correct any anomaly. Okay? We have 7. Please tell your colleagues that are not yet connected to connect now. We're going to start an aspect of discussion that is very, very important. Very, very important. And I want to plead with you not to miss this. So this is very, very important. And I want to appeal to you all to put on your thinking cap as we're going to discuss this. Okay? Shall we start? What's your suggestion? Should we start? We don't have up to 10 yet. But I feel we can't.
Let's wait for them.
We should wait for them. Okay, great. So please call those that are outside the class to join now. And please share the link so that they can all connect.
Maxwell, stop showing us your face.
Sir, we can't hear you, sir. Sir, we have not been hearing anything.
Can you hear me now? Hello, can you hear me? Please respond if you can hear me.
Yes, we can
Yes,
now
sir.
hear. We can now hear.
Three types of prognosis in medical science. Okay? Prognosis means outcome. Okay? So when you treat a patient, there are times you'll be asked what is the prognosis that that patient would survive. Okay? So I'm going to stop sharing this and I'll activate my whiteboard. I'll activate my whiteboard to make this quick illustration. Okay? Can you all see my whiteboard? Can you see my whiteboard?
It is loading, sir.
Okay, great. Okay, great. So I pick a pen. I said we have what we call economic prognosis. Economic. Please, if you have a pen, please write. We have what we call disease prognosis. Disease. Let me just put it as D and 6. So that's disease. I hope you understand that. And also we'll have what we call social prognosis. Social prognosis. Everything is prognosis. Okay? Prognosis. Okay? So let's start from economic prognosis. Usually, as a veterinarian, when you treat animals, these three types of prognosis must guide your decision. Okay? These three types of prognosis must guide your decision. The economic prognosis talks about if the animal you have treated will be able to benefit your clients economically. You know, there are some diseases when there's an outbreak of certain diseases, like for instance, there's this disease called they call it ED76, egg drop syndrome. It's a kind of poultry disease that affects the reproductive tract of poultry birds. When these animals are affected, from research reports, these animals usually don't return back to their full egg-laying potential. So many a times, when you have to treat animals, when you have such outbreak, you have to advise the client. You have to advise the client that please, it is better you sell off these birds because their egg-laying potential has actually dropped as a result of this disease outbreak, and it will never pick up again. I hope you understand what I'm saying. Usually that disease manifests in form of weak shell of egg and shelllessness of egg and different things like that. So what happened is that you advise your client based on the reality. So what is the prognosis of that treatment? For instance, there are some diseases when they affect cattle, okay? When they affect cattle, the cattle, at the end of the day, the cow will not be able to produce milk. If it's a dairy cow, if it's a dairy animal, it will not be able to produce milk as expected again for the owner. So, excuse me, please. So as a result, you advise your client based on the outcome of that. So it's not enough for you to just treat an animal. Don't just commence treatment. There are certain things that must guide your treatment. So, and the economic outcome of that treatment is very, very important. Now, the second thing is disease prognosis. Disease prognosis, okay? There are certain treatments where you do to animal. Many times the animal don't often survive. No matter how, you can only manage the animal for a while, but ultimately the animal will die. So when you see a kind of disease like that, an animal is already showing signs of rabies. Do you begin to commence treatment? No, you don't treat such animal. An animal is showing indication, you are seeing evidence of bacillus anthracis infection in the animal. So there are certain diseases like that you don't bother treating. Okay? So we say that one is what? Disease prognosis. Okay? Now, why the last one is social prognosis. Okay? Now, for instance, there are some clients that will present their pets to you. The pet is more than just a pet. It's even like a child to them. So, to begin to tell them that, sorry, this animal cannot produce a puppy for you, doesn't make sense to them. Their own is treat this animal. You already saw the client crying in your presence, shedding tears because of the emotional connection the client has actually built with the animal. Okay? So there are times we go ahead to treat some patients, not because it has good disease prognosis, okay? Not because it even has economic prognosis, but because of social prognosis. The implication on the owner, on your client is very, very devastating. So you still have to treat. That is why, some years back, I was at the university teaching hospital here in Ibadan, and I met a man who was just running around. He said it was an emergency. I looked at the man was quite above 100 years.
We can't hear you, sir.
Now, can you hear me now?
Yes, sir. We can hear you now.
What was the last statement?
Sir, some people are in the waiting room.
What was the last statement you heard?
We just started our new person.
Sir, the last thing I heard was when you asked, can you hear?
The last thing I heard was when you were talking of somebody you met at teaching hospital, Ibadan.
Yes, an old man that was presented at teaching hospital. And people were running around, the family members were running around trying to treat the man and save his life. But to me, I felt, what is this? That was already old. In fact, I can tell you from a distance that the man should be around 110 or 120. If you are the one, will you still treat that man?
Well, what you have to understand is that.
Anybody?
So, it's not about that we don't allow people.
Sir.
Hello? Hello?
We can hear you, sir.
Yes, somebody wanted to say something. Who is talking? Okay, let's continue if there's nothing to say. So I mentioned that to tell you about social prognosis, okay? Social outcome of the individual is very, very important. And these are the three things that should guide your treatment, okay? Should guide whether you're going to treat a patient or not. So if that is taken, I'm going to end this, I'm going to close this whiteboard and I'll continue from where I stop on the PowerPoint slide. Okay, I can see a few people in the class there. That's interesting.
I have a question, sir.
All right, go ahead, ask your question.
Yeah, I wanted you to help buttress more on the economic prognosis you talked about.
Sir, my own question is on that social prognosis, both the social and the economic.
Okay. So what I'm just saying is that the outcome of an event is what we refer to as prognosis. Okay? And
Yes,
there are
sir.
three types of outcome we can view as veterinarian when you treat patients. Okay? The first is the disease outcome. Would this disease, is it treatable? Is it actually treatable? Can you manage the disease? There are certain diseases you don't need to waste consumable on them. It doesn't matter the amount of consumable the animal is going.
Like that of the bacillus, I mean,
Yes.
anthrax.
Anthrax, bacillus, rabies infection, and a number of diseases like that. The animal will definitely die. Okay? For instance, you already saw an evidence of gumboro among your DO chicks and all that. The best you can do is to call those ones that are not sick. The sick ones are likely going to die. So you don't begin to waste drug on them. Do you understand?
Yes, sir, I do.
Because if you start treating those animals, and at the end of the day, your client paid you, gave you money, and you spent that money on drug, and at the end of the day, the animal died. Are you getting my point? You will appear to be,
yes, sir.
You will look like
a quack,
somebody that is not well trained. You understand?
Actually, sir.
So that's why we say you look at disease prognosis. What is the possible outcome of this thing? Do you treat? So that's what we're saying. I would say economic prognosis is what would be the economic status of the animal after you have treated. Some people are making noise in that classroom. So what would be the economic status of the animal after you have treated them? Will these animals, if it's a dairy animal, will it still be producing for the owner? If the animal is egg laying, it produces stable egg, will you still be able to harvest the required egg after feeding the animal? Okay? So if it's going to constitute economic loss to your clients, you don't advise the client to start treating now. Do you understand? And of course, the last one.
Yes, sir.
Of course, the last one.
Just understand that this man. Why not connect and leave it? Listen to the man after the past week.
You know, in one mind.
Hello, sir. I have a question. Are you still there? Hello, sir. I have a question. Are you still there? Sir, are you still there?
Ahead.
Okay. Okay, I just heard you now. So my question is this. When you spoke about the economic prognosis, and you made mention of the fact that if the treatment would lead to a major economic loss, then it is not advisable to head on with the treatment. Now, what if the persistence of the disease we are not trying to treat would also in the same vein lead to economic loss? What would one now do in such instance?
Hello? Hello?
I can hear you, sir. I just started hearing you now.
So I said you should say that again. Say what you just said again.
Okay. I asked a question concerning the economic prognosis.
Yes, I heard
And
that.
when you were explaining it, when you were
Go ahead.
explaining it, you made a mention of the fact that if the disease, or rather, if the treatment you are trying to undergo would lead to a major economic loss, then it is not advisable to treat. Then I'm now asking that, okay, if the persistence of the disease we are not trying to treat now leads to also an economic loss, what would one now do in that instance where both
No.
headways will lead to an economic loss?
But please get me right. This is what I'm saying. That before you treat an animal, you look at, because your goal, treating human is squarely social. Okay? Your brother is ill. Your
Yes,
mom
that's
is
true.
ill. Your dad is ill. It's social. Nobody will say, after all, the daddy is old. He cannot send you to school again. Now, why are you treating him? Nobody is going to reason that way. Okay? But when
Yes.
you deal with animals, you look at three things. Okay? Look at the economic. That is, after treating this animal, would this animal be able to get me what I need?
Okay.
That's what we are saying. After treating this animal, for example, your goat has PPR. And from the look
Okay.
of things, after treating this goat, it could barely live to produce kids again. You're not there to be looking at the face of the goat now. Your goal is not
Yeah.
to be playing with the goat. What you need from the goat is for the goat to have kids for you to sell. But if
Yes.
after treating the animal will not produce that for you. You will have to advise the client and tell the client that, what is your goal for keeping this animal? What's your goal for keeping these birds? After we have done this treatment, it can be successful. We are not saying it won't be successful, but you are not going to get egg as expected again. Let the owner begin to be well informed so that the owner will now take decision based on that economic prognosis.
Yes.
Ideally, the birds are supposed to be producing 10 crates of eggs in a day. And you realize that by the time I treat this animal, they will barely be producing 4 crates of eggs. Remember that many a time that does not stop those birds from eating and eating.
Yes, of course.
They will still be eating. So the implication is that your client will be running at loss. Number one, he will pay you. Number two, he will be feeding the bird, and the bird will not produce enough to take care of the financial
The
cost.
cost. Yes.
That's the economic prognosis. You do that. That's what. If you can't take anything from this class, please take that message, because you are going to be veterinarians. And this thing I'm telling you, you will not hear it anywhere. That these three things should guide your practice as veterinarians. Economic prognosis of your treatment, social prognosis, disease prognosis. The disease prognosis is the fact that, will this animal even survive? Can this disease even be treatable? Is it treatable in the first instance? Okay? But in human, nobody wants to know if it's treatable. They will say, doctor, just do something. Anything you can do for us. The doctor must just try something out. Nobody wants to hear, sorry, there's no cure to this. Let's go and dig. Let's go and be digging the grave. If you have money, go and buy coffee and keep. Nobody wants to hear that when it comes to humans. You understand? So,
Yes, sir.
those in human, they will think only of social prognosis. But those of us in vets, we look at social prognosis, we look at disease prognosis, we look at economic prognosis before we treat animal. So it's not every animal they brought before you that you start treating like that. Don't just start shooking them something and start treating the animal, putting them on this, putting them on that. Look at the implication on the animal before you begin to treat. So that your clients will not get disappointed in you. Doc, you did not tell me this before. All right.
Okay, but sir, it's left for the client to decide on the next phase.
But it is your responsibility to educate the client.
Action.
It is your responsibility to properly inform for your client to make an informed decision. Don't tell your clients you are probably lost that client. You will just see you as an incompetent person. So we leave that.
Yes.
Like I said, that is still a function of probability we are discussing this night. Okay? So it all boils down to probability in decision making. Okay? So again, I said medicine is an inexact science.
Yes, sir.
An inexact science, you cannot stick out your neck, you cannot bank on anything.
Doc, your voice is faint.
Now.
Doc, your voice is faint.
Okay, let me try something. Okay, just a minute. Some people say my voice is faint. Is it loud now? Is my voice okay now? My voice okay now?
Yes, it's loud and clear.
Yes.
Okay, great. So let me. Okay. Can you still see my slide? Can you still see my slide?
Yes.
Okay, great. So
yes,
I said,
thank you, sir.
Medicine is an inexact science. I've said that what I meant by that. Okay, that is why we call it in science. We even talk of research. How many of you have heard that cholesterol is no longer hazardous to health? There are certain things that were figured out in the past. Sometimes you can review.
I've not heard of it.
You've not heard that. Okay, no problem. So, some point it will be reviewed, and review keeps going on. Okay, things that were considered impossible in the past, medical science, general science, we figured out that today they are even possible. So it is important when we look at statistical inference too, that probability is at the heart of whatever we are doing. So basis for decision making for patient management in the face of numerous uncertainty, such as diagnosis. What is diagnosis? Can somebody tell me what is diagnosis? When we say diagnosis, what does it mean? What does diagnosis mean? To diagnose. Hello? What is diagnosis?
Anyway, yeah, I can say that diagnosis is using different techniques coupled with instruments to make or to come to conclusion the probable form of a disease.
Hello?
Yes?
Yeah. I think diagnosis is kind of like the identification of a nature of a cause or a cause of a disease or a cause of an illness.
Cause of a disease, okay? Using techniques, using experience or whatever, okay? To come to conclusion on the cause of disease, okay? Good. So, talk of diagnosis, we talk of treatment, we talk of prognosis. I've discussed prognosis at length, so I'm not going to go through that again. So, Probability also allows us to measure the degree of uncertainty. So it is important. We are trying to apply probability. What is the relevance of probability to our profession? That's what we're discussing. Okay? Because you'll be wondering, why am I teaching probability? Why are we looking at probability again at this level? We thought we finish it at the whole ordinary level. Okay? It's important here, and that is what we're discussing. So we're able to also measure uncertainty. Okay? And it also allows us to translate data into decision making. Okay? Now, rationale in medicine. Look at the first statement here. A patient may want to know the chances of his survival before accepting a medical or surgical treatment. So, and it comes to you as a veterinarian. That is where your knowledge of probability must come to play. You must be able to explain to the patient with a measure of certainty the chances of the survival of that individual. Somebody is presenting with a case of
depression.
Well, depression may not really be a serious one. Let's talk of cervical cancer. Okay, cervical cancer, or talk of tuberculosis, or you want to talk of all these bone diseases. Okay, or maybe you have case of kidney failure. You must look at what has been treated in the past. What is the chances of survival of that person? Now look at this second statement. For example, a depressed patient once said he had read that the chances were 60% that she would respond to antidepressants a doctor had prescribed to her. Now that means that 60% of time I will feel better on this, right? She was asking, okay? Now the doctor replied, he said, well, not exactly. The doctor explained that if 10 people with a depression just like hers walk into his office, about 6 will be expected to respond to the antidepressant. So that's what we mean by 60% chance of responding. For instance, there's a surgical procedure and you have to treat a patient with that new surgical procedure. And you are saying, well, the chances of this patient surviving is 70%. 70% in that case does not necessarily mean that the patient is going to feel well 70% of the time. No. But that out of every 10 patients that you apply that procedure to, 7 of them will usually survive. That's 70% survival. Okay? I hope that makes sense.
So the person can actually be among the 30%.
Yes, you can be among the 3 out of 10 or 7 out of 10 that survive. So, but you can appreciate what we are saying here. Of course, it's still a chance, it's still a risk. But nobody wants to hear that because many a time you will not think of the 70%, you'll be thinking of 30% that died. You say, are you saying that this thing will take my life? No, that's not what we say. So that's application of probability in medical science. Okay? So the dynamics of clinical situation will determine probability of a given patient developing specific disease. A smoker has higher probability of getting lung cancer than a non-smoker. Okay? An individual will either get it or not. So when you say
Sir, we can no longer hear you.
Sir, we can.
is associated with lung cancer, okay? Does not necessarily mean that every smoker will get lung cancer. I hope you are aware of that. I'm only saying that there's a measure of chance that when you smoke, you're going to end up with lung cancer. Because there are some non-smokers that are getting lung cancer. Are you aware of that? Somebody
Yes, sir.
and yet you end up with lung cancer. So a lot of things determines age, exposure to toxin, the genetics of the person. So many confounding factors are very important here. So probability and decision making. Have you ever had a difficult decision to make as a medical practitioner or an individual? Do you end up making decisions based on your intuition? Most times the decision we make are the wrong ones. Sometimes decision making may be very hard. That is the whole essence of looking at how to apply probability in veterinary profession. Okay, why do we have difficulty in decision making? Based on its complexity, the inherent uncertainty in the situation, a decision maker may be working towards multiple objectives. A decision persuasively leads to difficult conclusion. More importantly, we are dealing with animal life and indirectly human life. Okay? So these are some of the concepts of probability you should familiarize yourself with. I'm not going to waste too much time on that, but we're going to spend a few minutes here as we're going to conclude the lecture on this aspect. This is the aspect we're going to conclude the lecture. And I want you to pay attention very well, because this is where it gets tricky. Okay? Now, in studying probability, there are three approaches to study probability, or you call it three perspectives in studying probability. We have what we call the classical view of probability. We have the empirical view of probability. We call it empirical or frequency concept of probability. And you also have the subjective. Subjective. Okay? Let's start from the first one. So this is the type of probability. That's the classical, or you call it priori, or you call it the traditional. You can call it traditional, classical, or priori. Okay? So this is the type of probability where you quote from prior information. For instance, you have 13 out of 60 who sat for VPH 527 failed in 2016. This is the chance of passing this year. Can somebody tell me that? Just divide 60 by 13. 13 over 60. Okay? You said 13 out of these that have failed. What is the chance of passing? Okay, sorry. It's not 13. You are going to subtract this 13 from 60, right? What would be the answer? Some don't understand probability again. What have they said? Are we going to start this all over again?
Yeah,
47, sir.
So what should be the answer to this question?
come back soon. For 1 hour time, we start on the Sunday.
60 minus 13 is 47.
So what should be the answer to that question? What is the chance of passing this?
Which yourself.
What's the chance of passing?
Wait, 1.67, sir.
For what? Is that what?
21.67% chance of passing.
Where did you get that?
21.6 21.67% of failing. Then
Passing is 78.3%.
78.3% for passing.
No. We are not asking in. Okay, give your answer in fraction, not in percentage, please. So that you don't make things difficult for us. Give your answer in fraction, not in percentage. Don't express it in percentage, please.
Okay, what I did was 47. That's 60 minus 13,
Okay.
which is 47, all over the total start for the course, which is 60.
Okay, you are correct, okay? But my point is that if I don't ask you to express it in percentage, you don't have to do that. So you just say 47 over 60, and that is your answer. Is that okay?
Okay.
You don't really need to express
Yes,
it,
sir.
except I deliberately told you to do that. Okay, so that is what you call the classical or the priori approach or traditional approach to calculating probability. If I told you that I toss a coin up, okay? Just toss a coin up. What is the chance of getting head or tail? Who can tell me? What is the probability of getting a head? Let's start from there. What's the probability of getting a head?
1/2, sir.
1/2, sir.
1/2.
Yes, 1/2. And how did you get 1/2? Because you know the possible outcome, you have 2 of it, okay? The probability of getting 10 will be 1/2. So what you have just done is that you have made your calculation from the prior information I gave you, and that is traditional, okay? Now let's come to empirical approach.
Sir, your voice is going dim. Cannot hear you again.
Let's come to empirical or frequency approach, okay?
All right.
So we'll come to empirical or frequency approach. And in the case of empirical or frequency approach, there is always need to conduct a trial. Okay? This type of probability we calculate based on information we collect. You have to collect an information before you can tell what answer to this is. Okay? Let me use that same example. Just use it. Okay? The last example I used, classical approach. Now, if you are to toss a coin up 5 times, what is the probability of getting a tail? Can somebody help me? You have to toss a coin up 5 times. What's the probability of getting a tail? Are we good?
1/5, sir.
It's confusing, sir, because you can actually get the tail more than once. You can get the tail the whole 5 times. Depends.
Okay, that's fortune talking, right?
Yes, sir.
So let me listen to Martin. Martin, you are on.
Sir, I think it's 1.
You, this student, you will not kill me. All these your answers are making me laugh. So what am I saying in essence is that will be an example of empirical probability approach. In this case, you will not just use what is in your head. You go and pick the coin. You go and pick the coin and toss it up and be recording how many came out head, how many came out tail. Okay? You now use the number of tail over the total number of toes, which is 5. It will give you what my answer should be. Understand? So in this case, your calculation is based on the information you collected. Okay? Not just on an assumption or an impression. Do you understand my point? For instance, if I said, if I conducted a test, okay, what is the probability that somebody will fail in the next one I'm going to conduct? You are going to conduct that test and know the number of people that will actually fail and put it over the total to know the probability that somebody else will fail again. So when you have a probability approach where you have to carry out trial, you have to conduct the event yourself. Like the first one I gave you, it wasn't as if you threw any coin up, but you just made that consideration based on the prior impression you had, right? Okay. So that is what you say classical against empirical. Let's conclude with the last one, which is the subjective. This subjective is otherwise referred to as a judgmental approach of probability. Okay? Judgmental or sentimental. You can call it sentimental, subjective, judgmental approach of studying probability. Now, in this case, you just decide what the answer should be based on your bias, your personal bias. For instance, those of you that are in the class, I want an answer from those people seated in the class there. Is it just you alone that is seated in the class? NVMA, CSL?
Yes, sir.
Okay.
We are just the ones, the 5th year guys.
Okay.
We are the ones in the class at the moment.
Okay, let me ask you this question. Let's assume a nurse walked into that your class. A nurse walked into that your class. What is the probability that the nurse is a male or female?
It's on top. Up.
Sir, like
up.
you say, a nest.
Up now.
Yes,
Sir,
nurse.
up.
Or is it nurse? You want me to call it nurse? A nurse. Let's assume a nurse
Okay, sir.
walked into your class. Would that nurse be a male or female?
A male or a
Now, this
female,
you
any
can
of
do.
them, sir.
I said, what is the likelihood? What is more likely? Is it more
A
likely
female.
a female? Yes, that's where I'm going. So, because you have a bias that a nurse is most likely going to be what? A female. So, when you make probability judgment based on that sentiment, okay?
Yes, sir.
Somebody just told you, the chairman is a very rude person. Are you getting it? Before you even met the chairman, your mind is telling you that, what kind of man is this?
Actually, sir.
They said they said the chairman is very rude. You'll be looking for a man the next time you are looking for a chairman. It will be a shock for you to see a lady. Are you getting it? Because we have that sentiment that when you say chairman, the person should be a male. Okay? So those are the three approaches to probability. Are we good? Do I need to explain again?
We are good, sir, but
Yes, sir. We understood.
I have an issue with this empirical or frequency concept, sir.
Okay.
Sir, based on the examples you gave us, that if we toss a coin 5 times, that was the probability of having a head. Sir, so the way you approach the question, you were telling us that for such a thing like that, we will need to conduct the experiment. So, sir, I'm now asking, or my question is this, that can't we, by our natural logic and this formula, apply it, and then we will get 5/2? That is 2.5. That should be the probability. Must we do that practical? Must we subject it to a live experiment? Thoughts are my questions, sir. Sir, please, can you hear me?
So any situation that requires that you conduct that experiment, you are still looking back, you are distracted. I'll move on to the next thing if you are not attentive. For instance, the example I gave on classical, I said, let's assume a coin is tossed up. What is the probability of getting a head or tail? You need to toss a coin up. You don't need to toss a coin up.
No, sir.
But in the case of when I say tossing a coin 5 times, it will take a witch to know what will come up. In that case, you have to carry out that experiment. Okay? So any probability approach that requires you conducting an experiment or conducting a trial or conducting an event and see what practically will come out is what we refer to as the empirical. Okay?
Yes, sir.
Anyone you don't have to do that you can use the information you are given to compute, it is classical. Okay. I hope that is clear.
Yes, sir. Thank you, sir.
So the frequencies approach is the approach that is commonly used in statistics. That is the empirical approach. So the frequency is purely objective. You don't use your idea. You don't use subject. Okay, maybe somebody call me a researcher. That researcher should be a male. Okay, you just conclude the person is a male. So I'm trying to tell you that why probability is at the heart of statistics. There's an approach of probability that is used in statistics, not the classical, not the subjective, but the empirical approach. Please take note of that. I can break that in multiple choice question. That of these approaches is used in statistics. Which of these approaches of probability study is used in statistics? I'll put classical there. I'll put empirical. I'll put subjective there. Okay? So the answer is empirical, or call it the frequentist approach. Okay? So empirical is actually objective. It's against subjective. Okay? So it's important you know this. Very, very important. So look at the screen and jot down. You can do a quick screen grab of the question on the screen. Quickly now. I give you 2 minutes. Do a quick screen grab or snap or whatever, or you write down the question on the screen. You're going to submit to me. I will use this as an entry on Wednesday. If you are not done it, don't bother show up on the Zoom class, because I will not admit you.
We should answer it now, sir.
You are not to answer it now. You answer it between now and Wednesday, or you must send it to me on WhatsApp personally. So each person should have my WhatsApp number and send me your answer privately on the chat on WhatsApp. Are you done writing it down? We are going to end at this point this night.
Yeah, we have screenshots it.
Okay, screenshot. Good. You can share it on your class group. I want these things submitted before 1 hour before our class, so that, no, sorry, 2 hours before the class, so that I can admit those I want to be in the class. I don't need everybody to be in that class. I don't need anybody, but I can assure you, if you miss any of my class, the rest will be like magic when we start. We will be talking strange language when else you enter. And that's why I want to plead with you. Don't miss any of the classes. I don't go back. Don't tell me, please, go back to where you started from. I don't go back to Egypt. When I leave Egypt, I face Canaan. Okay?
Sir.
Yes.
I have a question. Are you supposed to follow a particular approach in probability approach in answering these questions?
The question is that there are 3 options to each of these questions. At each of these questions, and tell me the right approach you will use. Is it classical? Is it empirical? Is it subjective? Just put that answer alone at the front. Okay?
Sir, can you help us do something?
Do what?
Can you just help us go back to that slide of the 3 approaches?
I've done something.
Okay, sir.
So
Thank you very much.
You are not noting it, right? Okay.
Yes, sir.
So just write the question. When you are submitting to me, you type it on the chat, WhatsApp chat.
Yes, sir.
Don't screenshot a notebook and send to me, or I won't look at it. Type it on the chat. First question, type. Then the answer classical. Second question, type, answer empirical. 4th question, do that until you are done with that. Okay? And you have to submit 2 hours before the class on Wednesday. If you have not submitted, don't bother show up for the class. If I have just 2 persons, I will teach the 2. All right. Thank you very much for your time.
Okay, sir. Good night, sir.
Good night. Yeah.
Sir, you're welcome. Okay. I want to record this.
We can handle it, yeah.
Allow